Please welcome to the stage Alejandro Rincón of NTN24 and our esteemed panel.
We all set up. Thank you so much for joining us this afternoon. It's an entire pleasure to be with us. Allow me first to introduce everybody in the discussion, and I'm just going to refer to my notes just to make sure that I'm technically good with everyone. So, Shannon Thyme, she's the Chief Legal Officer and President of the Moderna Charitable Foundation. Thank you so much, Shannon, for being with us. Also, Anil Soni, who is the CEO of the WHO Foundation. Thank you so much for being with us. And then we're also having the pleasure of the Honorable Karl Hofmann, President and CEO of Population Services International, as well as Elisabeth Staudinger, which is the part of the managing board of Siemens Healthcare. In that context, this is a very important discussion for all of us today, especially as the entire world is trying to move forward on the recovery process of an entire crisis, which has had a lot of an effect on all of us, which is the pandemic, the COVID-19 pandemic. And in that context, what we want to do is share the best practices from our experience on how the public and private sector can cooperate and make a lot more and just go further into evolving and having just more resilient and effective healthcare systems. So, Shannon, if we can begin with you, from your experience, what do you think is the best lessons that we have learned on equitable vaccine distribution and the role of Moderna in all of this big process?
Thank you for the question. Thank you for having us. You know, for Moderna, we're trying to have the greatest impact on human health that we can, and that includes ensuring equitable access to vaccines. We really saw four things that we think public-private partnerships need to come together to solve if we're going to create the kind of sustainable health systems that lead to better outcomes. The first is really understanding a reliable procurement mechanism for low and low middle income countries. Gavi Kovacs did a very nice job stepping in an emergency situation, but how do we make that more robust so you don't need to lean in so quickly? Second is really thinking about global supply chains, really asking countries not to create trade restrictions or export blocks, but to allow free movement of goods across the supply chain quite quickly so everybody can have access to important healthcare. Third is really working together in the regulatory system, and how do we get regulators to come together and understand how to move more quickly, how to build clinical trial capabilities, and really, again, how to create a system that becomes self-sustaining for future pandemics. And finally, data and data transparency. How do we make sure everybody has the facts they need to make the right decisions, both regulators, but also individuals?
Now, in that context, let me jump now to you, Anil, because one of the main discussions that we have had throughout this crisis is definitely collaboration and strengthening that between the public and private sector. From your experience, is there any challenge in particular that you would like to highlight and share a little bit about what do you think it's important for us as a big lesson on just to how strengthen and what actions can be taken just to be more resilient probably in the future?
Well, one of the lessons, particularly coming out of the pandemic and with the work of the World Health Organization, was around accurate information and the risk of misinformation or an infodemic. For any of you who've had a challenging moment in your health, or if there was a new virus, you open up the internet, you go to Google, and you ask yourself, how is this transmitted? What do I do to keep myself safe? What's the appropriate treatment? In fact, information on the internet is now one of the most important determinants of people's healthcare. So during the pandemic, social media companies recognized that they had an important responsibility to make sure that accurate information around the pandemic was being available to anyone around the world. And the WHO worked with Google, Meta, and other social media companies so that hundreds of millions of people around the world in multiple languages had access to accurate information. That work is continuing because the pandemic's emergency phase may be over, but there's a lot of health threats that we're facing, and there's a lot of misinformation online. So those very companies, Meta and Google, are cooperating through the WHO, not necessarily with one another, but through the WHO on a health misinformation claims platform. So essentially, their employees can go to the WHO and say, we're seeing online chatter that says this disease is spread in this way, and the WHO can either validate or say, no, that's not true.
It's kind of like a fact-checking
Exactly, and that can then be promoted through search. So that's great, but it is reactive. Part of where the WHO is trying to go, and this is going to require collaboration with the private sector, is getting proactive, is actually saying, how do we use tools like generative AI to make sure that the most accurate information, new evidence, because there's new evidence all the time, there's health innovation all the time. How do we make sure that information is getting out to healthcare providers, out to the general population as quickly as possible? So that's going to absolutely require engagement with technology companies.
Now, in that context, you mentioned something which is, I think it's great and it's part of the context, and that is, how do we get out of the emergency mentality? And sometimes probably one of the biggest challenges is exactly, okay, we're responding to this is what we need to do in the medium term, but in the future, in the longer run. And maybe, Elisabeth, you can probably tell us whether or not, from the experience at Siemens, what actions concretely do you think or do you believe or have you undertaken to just in the longer term help to build more resilient and equitable, probably, healthcare systems?
When you look at healthcare, you can compare it a bit to the saying, it takes a village to raise a child. Maybe that's also a good way of looking when it's about building a resilient healthcare system. You have to combine a lot of different components, and you need to make sure that every of these components contributes and makes a difference. And for us as a private sector company, there is of course certain products or solutions that we can bring to the equation, but that's only one of the pieces, right? And then we need to build on that and see what else do we need, right? We maybe need training, we need to make sure we upskill the healthcare workforce accordingly. And we also can think about which other innovations can we bring to the table to make a difference, to connect the different players across the ecosystem.
And then in that context, of course, Karl, pretty much the same question to you, but is related into moving forward different kinds of actions. How do we strengthen these alliances between the public and private sectors on this same front?
Thanks, Alejandro. And first of all, let me say it's delightful to be next to two great private sector companies, right, working in the healthcare space, and the WHO, represented here by Anil and the foundation, but Siemens and Moderna. I mean, Moderna, a company that we've all come to know, and Siemens, a company we've known for decades, right? So my own organization, PSI, a global health nonprofit, we work in about 40 countries, and in the 50 years that we've been operating, we've always worked. The starting premise was really working with the private sector, the indigenous private sector, not the big international leading private sector companies, but local private sector players, because you know that it's often the private sector that is delivering healthcare products and services to those who need it most, because the public sector may be too weak to do so. And so the private sector, you know, has been sort of part of our DNA from the very beginning. And over the years, we've come to understand, of course, our work fundamentally has to be aligned with national healthcare policies in the 40-plus countries where we work. The health ministry needs to be the steward of the health system, but we all know the health system is mixed. I'm not aware of any place, certainly no place that we work, where the healthcare's provision is exclusively through the public sector or through the private sector, right? These things have to cooperate. These sectors have to cooperate to make the whole system work effectively and equitably for everybody. I think the organizations like mine, which have this proclivity to work with the private sector, are trying to ensure that it's quality care and services that's being provided. So I think there's a quality piece to this, but there's a connecting the dots piece, a systems sort of thinking piece, how to ensure that the regulators and the policymakers are looking at the private sector and the way that it contributes to healthcare outcomes in just about every geography we can think of. And ensure that it's all aligned and delivering quality care for the people who need it. That's the work we're trying to do.
Now, in that context also, it will be, I think, highly valuable, not only to share what we just did, but also any concrete experience that you would like to highlight that probably defines the character as to what's important into defining those more strong relationships between the public and private sector. But I think if you can illustrate us, and this is kind of a freestyle question in terms of like whoever has an idea, just jump in, feel free to do so. Any particular example that you think it's valuable?
If you don't mind, I'll start. I mean, we've had an experience over the last several years working on HIV self-testing technology, right? This is something that we could walk down the street to the nearest Walgreens or CVS and buy here in the US. You couldn't buy it in many markets in the developing world, including those that were heavily impacted by HIV. And so with the help of funding from Unitaid, we worked with private sector manufacturers, regulators, policymakers to do the necessary to introduce self-testing as an HIV prevention strategy in, I think, 20 or 25 countries now. It's expanded. Our intervention was really to pilot the idea, to create the regulatory framework, to introduce new providers, and then to exit and watch the market flourish. And it has. It's absolutely flourished in our absence. So it's a great example, I think, of a development intervention that's turned into a sustainable market-led, consumer-led intervention that is not going away anytime soon. And that's one concrete example.
Yeah, and I might just build on that. One of the things that we're really excited about is what we're doing through the Moderna Charitable Foundation. And we're working with social entrepreneurs like Vanessa Carey at Seed Global, who's really, to your point about healthcare being local and systems not being completely homogenous, on the ground working at both clinical education, on the ground training of physicians in those countries, again, to go to the quality metrics. How do you improve the quality of healthcare in places where they may not have access to the same quality healthcare we do, to be the pull-through in the system, while at the same time working in the public-private space to make sure that you've got the manufacturing, you have the supply chain, you have the delivery systems, but at the end of the day, it's on the ground where you have to make a difference.
I would maybe want to share a really nice example from Kenya, very interesting one, where we were looking at how do we bring vaccines, medicine, but also blood testing to more remote locations where you may not have the right infrastructure in place, you don't have the roads, you don't have the whole kind of broader facilities in place to serve these communities. And there we teamed up with a company that makes drones, plus together with the local kind of government, and created a service where we use drones to actually shuttle both the medicines as well as the blood samples to remote areas and then back to the metro centers where you then can turn around the information. All of that was digitally connected, so you can also send the results of the tests directly back to the patients or the people in these remote areas. It's a small example, but I believe a very, very fascinating one, how it can use technology to just move beyond some of the barriers. You feel, well, as long as if we don't fix this, nothing will happen. Actually, sometimes you can leapfrog. And
probably like empowering to many communities too, maybe underserved communities that in terms of technology, they're lagging in a way. Any experience in particular?
Well, what comes to mind, and this builds a bit on Karl's example, before I joined the WHO Foundation, I was at a global pharmaceutical company, and one of the things we tried to do was engage with consumer insights. And there's a direct alignment. We were a company that wanted to sell products, but we wanted to sell products that were relevant. And by engaging with local stakeholders, you can design products that meet patient needs, that meet consumer needs in a way that advances the company's interest, but also patient interest. And an example of that in South Africa was an initiative that's still underway where we would be combining HIV prevention and contraception. So a single pill is doing both. And actually the ability for young women to go to a pharmacy and purchase and take contraception, oral contraception, was a way that they could be further protected with HIV prevention without the stigma associated with taking a pill to protect themselves from HIV.
And now finally, as we're almost coming to a close to this very interesting and essential real conversation on this topic, what would you like to see in terms of biggest challenge that should be addressed or that should be tackled to, again, and strengthening these collaborations between public and private sectors?
Well, especially given the topic of the panel, resilient healthcare systems, what I would raise, try to amplify, ring the bell at the center of town in terms of urgency, is the intersection of climate change and health. And the need for us to be much more engaged in thinking about building resilient healthcare systems relative to the risks of climate change. And these are no longer years or decades in the future. I was really floored by the degree to which the floods in Libya last week. There are people who are no longer alive right now because of climate change. I mean, people are dying of climate change all the time, and we don't necessarily call it that. We have a lot of other specific causes of mortality or morbidity, but we need to reframe it, because in Libya, it was the creation of storms that have never existed before, putting pressure on infrastructure that had never been designed for that pressure, that led to the dams collapsing and entire towns and communities being wiped out. How do we anticipate that? At this point, as much effort as is going into mitigation, and of course we want those efforts to be successful, we can look and understand the degree to which communities are not prepared for what's happening with climate change, both in terms of infrastructure, and by the way, the number one infrastructure investment, it's not a silver bullet, it's not a medicine, it's healthcare workers. And so we absolutely have to invest in the healthcare workforce, but we can also stay ahead of disease patterns. So we know dengue is going to explode. We know that's happening. And if you can look ahead to what the health risks are, there are incredible solutions. There's a couple of vaccines being developed for dengue, of course. There's also a naturally occurring bacteria that can prevent the mosquitoes from transmitting dengue to humans. We have to invest in those technologies, those opportunities now, because the pace of climate change and the pace of the effects of climate change on human health are going through the roof.
Okay, Shannon, maybe?
Yeah, I might just build on that. One of the things that we're super focused on is how do you continue to drive a community? No one company, no one entity is going to have the right answer. And I think you see so often all companies go in, all governments go in with the right intention, and they're all solving the first step in the problem instead of coming together in a different way to convene and say, let's split up the problem and segment it so we actually get more of the problem tackled together as a community trying to build healthcare systems. And that's something we're focused on with our technology, just democratizing it through our mRNA access program. And we're working with researchers in academia and governments around the world on the emerging diseases that today do not have vaccines, as we think about how CEPI and WHO define the potential next disease X. And I just would love to see more people come together, challenge us to do this as a community. I think we're at a moment in time we can make a tremendous difference if we do.
Karl?
You know, I want to, Anil used the word from his time at a pharmaceutical company, and of course I'm sitting between two representatives of big private sector companies. They tend to think about consumers. And I want to say, you know, this nonprofit that I am proud to be associated with, we think about consumers too. I think consumer insight, the recognition that you have to start every intervention, no matter what you're aiming for, with sort of listening to the people you're trying to serve, treating them as consumers with agency, with choice. Even though they may not have resources, they have the ability to make choice. You ought to treat them with the dignity that that represents. I think, you know, treating them as the fundamental building block of health systems as opposed to the subject of health systems. The agent, the fundamental agent of a health system is the consumer, is the individual. I think that's the sort of transformational idea that we try and hold on to in designing all of our programs. And I think it's kind of a thread that unites everybody here too.
Right.
Yeah. Elisabeth?
Maybe for me to wrap things up, I think it's very much connecting to what my other three panelists have said. I believe there is still a lot of opportunity of teaming up across the different players, of working with the local communities. And one word which is very important for me as I think about, well, how do we make things stick, is this doing things in a way that they are sustainable, that they can stand on their own feet, because that is the foundation for something to take a hold, take roots, and really make a difference, not only in the first month or the first year, but for the years to come.
So definitely, we're unfortunately running out of time, and we just don't want to take more space from our next speaker. So definitely, as you have all seen now more than ever, strengthening collaborations, participation between the public and private sector are even more essential than ever, since we're just keep learning lessons every day. Will bring definitely different challenges, and it's been our hope and our pleasure that from our experiences, we help guide those who are interested in such an interesting topic, just creating better, more resilient healthcare systems around the world. Thank you, everybody. It's been a pleasure.